Cyclists. Oftentimes, a lot of cyclists will come into the clinic complaining about what we call anterior hip pain. So that's pain in the front of the hip. Sometimes also in the low back, but mostly in the front of the hip. Sometimes what can happen is they'll say it feels like it's pinchy. It's pinchy right here, like in the hip, every time I come up on my upstroke on the pedal. And what that can be is, it doesn't actually have to be a joint. It can actually be what we call a femoral nerve issue. Your femoral nerve, if we look at this leg here, is this wonderful yellow line that comes all the way through into your groin. And oftentimes, what can happen is that this nerve right here can get impinged. It can get impinged on two muscles, your iliopsoas, which is this, which is right on your sacrum, and your psoas, which attaches actually to your spine. And in between these two muscles, this yellow nerve, this femoral nerve, peeks right through. What can happen is, if you cycle a lot, the muscle of your psoas and your iliopsoas can spasm, or it can create a shortening, or it can create adhesions. And what can happen is scar tissue can get in and around the nerve. So whenever you come up in a contracted position, you're essentially choking off this femoral nerve, which can cause you to have pain in the groin, or in the front of the hip, or on the side of your back. This is completely normal. It doesn't mean that you have a labral tear. It doesn't mean that you have a hip issue. It just means that you have an impingement of the nerve. What you can do is you can smash out your psoas, you can try to stretch out your psoas or your hip flexors. It's usually due to an issue with not having enough hip extension. Too much hip flexion, not enough hip extension. Honestly though, if you are having that pain, you should be looking into finding a specialist to actually diagnose that and figure out if you do have a nerve problem, because generally if they can diagnose it, then they can easily fix it. So that's what can be happening if you have what we call anterior hip pain. If you guys have any questions, don't hesitate to give us a call at our clinic, 214-862-1469, or you can DM us on Instagram, or you can find us more information at thesportspod.co.